Hi, so today I'm going to be talking about my anatomy scan results. I actually added this to my, well, originally filmed it with my 20 and 21st week update. However, the video got really long, so I decided to cut it off. So I'm just going to be talking about it now. So I had my anatomy scan today. It, it was really, I don't know. It was good, but then it was kind of bad also. We went in there, it was like really early. Baby was moving a lot, so it was really good. However, I drank, since they didn't tell me if I had to drink anything or if I had to have a full bladder or an empty bladder. So I just figured, I was like, hey, it's better for me to have a full bladder than an empty one and then have to wait and drink and drink. So I drank like a big cup of orange juice and then a water bottle, and then when I got there they told me they're like, it's an empty bladder. So I was like, oh, okay, let me go pee. So I went to the restroom, and then after that we did it. It was actually pretty short. The baby was cooperating a lot. She was moving, but the technician was able to get all the shots she needed. It probably took us like less than 10 minutes. And then she gave me a couple of pictures, and which ones were the ones she gave me? I think these are the ones she gave me. Yeah. There's this one, and it's like a profile, I guess, and then this is like the face, and then she also gave me this one, which is also a face. She confirmed that it's a girl, so that's exciting. She didn't print out a picture of that. But then after that, another doctor came in, and then this isn't my regular OB. I had to go to a different place, but the technician was like, oh, let me get the doctor so she can go over the results. And I was like, okay. And then the technician was really nice. She was telling us what we were looking at. She was like, oh, this is the brain, blah blah blah. So it was really cool. And then the doctor came in and she asked me about my due date. She's like, how accurate is your cycle, your like menstrual cycle? And I was like, well, see, I've been having ultrasounds and they've all been like a week behind, and then I don't really remember when my last menstrual cycle was. So she's like, okay. And she's like, does your OB know all about all these other ultrasounds you've been having, like the elective one, and then I had one early on also just to confirm the pregnancy? And then I was like, well, I don't think so. She's like, well, make sure she knows so she can decide whether to change the due date or not, because she said the baby was measuring 8 days behind. So 8 days behind my menstrual cycle thing. So I have an appointment with her on Tuesday, so like in exactly a week. So I will be letting her know, and she just said to take like all the ones I have. And then she came in and she like took some more pictures. I think hers are better. This is another profile, and then per feet. And Eric was like, wow, she's gonna have big feet. So this was one, and then this was the other one. And then she told us, she's like, everything, she's like, I'm just gonna double check that she did it right or whatever. So she's like, I'm just gonna take a quick look at everything again. And she did. And then she's like, everything seems great. She's like, the heart's fine, blah blah blah. She went over it. She was like, everything's fine. And then she was like, however, there is something I have to tell you. And then my heart was just like, what? And then she's like, it's nothing really to worry about much right now. However, she does have, her kidneys are dilated. And I was just like, what does that mean? But like so many things ran through my head that I wasn't really listening to what she said. However, she did say that they were 4 millimeters. She's like, they are just 4 millimeters or just over 4 millimeters. I don't really remember. I feel like she said just 4 millimeters, and that's what they have to be, less than 4 millimeters. So it's either just over or at 4 millimeters, and that's where it should, like, that's when they start getting concerned. And then so pretty much it just means that her kidneys are, I guess, they're not passing urine correctly or whatever. So it's like it has more liquid or something like that. Like, I didn't even ask anything. I was just like, okay. And she's like, but don't worry about it. She's like, This usually happens, and then we just she's like, it fixes itself by the next time you have an ultrasound, or by far by the end of the pregnancy. And I was just like, okay. She's like, so just come, I'm gonna have scheduled you for 4 weeks, and then we're gonna see if it has changed. So I was like, okay. And I was just like, okay. And I didn't like, I don't know, I guess I was kind of shocked, so I didn't really ask about it. And then I came home, and I was kind of like, well, on my drive over here, I was talking to Eric, and I was like, like, what does this mean? And I do use the restroom a lot, so I was okay. And then I wish I would have asked her, because I, like I mentioned, I drank a lot. And then even whenever the first technician left, I had a drink of water, like a big drink of water, while the doctor arrived. So I don't know if that has any effect on it, just because I did drink a lot, and then while I was there, I did have to use the restroom. So I don't know. I'm hoping it is, and then, but I don't know. I did Google it, like I said. It's pretty much says that a lot of people have this. Well, like a lot of babies have this, and it does get like better with time or whatever. However, also it says that like most of them were like, they were 7 millimeters, 10 millimeters, 20 millimeters, and like they don't really start getting like pretty much worried about it till like 10 or 20 millimeters. And I was just like, I wish she would have given me an exact number, but I'm pretty sure it was just 4 millimeters. So that kind of calmed me down. However, then I saw that that could be an indication of Down syndrome. And I didn't have the test, like the blood test done before, just because I didn't want it. And like we figured, like, even if this baby there's something wrong with her, we were gonna keep her. So it didn't really matter to us, I guess. But now I'm kind of like, I wish I would have done it, and then we had that percentage, and then, but then I could be worrying for nothing. So I'm just gonna, like, I already thought about it a lot, and I was worried, but I'm just gonna go with the flow. Hopefully on Tuesday, when I have my my OB appointment with my doctor, she'll tell me more about it, and I'll definitely ask her. And yeah, I'm just gonna go and say that everything's okay, it's fine. I actually personally use the restroom a lot, like even before I was pregnant. So maybe I'm saying that, like, I'm thinking, that's what I'm thinking. I'm feeling like my baby's just gonna have the same issue as me, and like a lot of my family members do. Like, it's nothing like serious or whatever, but like we use the restroom a lot. Like, I had to pee so much before pregnancy, and now it's kind of more just because I am pregnant. But like always, people would be like, oh my god, you pee more than whenever I'm pregnant or something like that. Like my sister-in-law would say that. She's like, you go to the restroom more than I do, and stuff like that. So I'm guessing, hoping it's something like that, or like nothing serious. Like I said, she said she didn't see anything else that would be an indication of something being wrong, just that like slight possibility. But she didn't seem worried, so I'm just gonna go ahead and say nothing's there. Hopefully on Tuesday, whenever I do have my appointment with my other doctor, she'll go over the results and tell me like it's okay. Kind of just wish she would have, like, I don't know, I feel like I kind of wish like they would see stuff like that, and if it wasn't like that serious or something to not worry about, they would just like look at it, and then whenever we have another ultrasound, come back and be like, oh hey, we noticed this on your last ultrasound, and it seems like this time you still have it, so this might begin to be a concern. Otherwise, then like having me worry here for 4 weeks. But I'm gonna like not think about it anymore. Either way, like, I'm staying positive. God does things for a reason. Like I mentioned, I do want to be a teacher, and I have worked with kids with Down syndromes and other issues through like high school, so I'm pretty sure I'm really good at it. And I don't know, like, I know God never puts too much in my plate that we can't handle. So yeah, but however, we're staying positive and saying that this baby's fine, and she's just gonna have to pee a lot like I do. Also, like the reading I've been doing, it says that some are born with it or whatever, and like their kidneys still dilated, and they just have to go through a few processes or like take medication or whatever, and it's gone like by a year. So odds are in our favor, I guess. If you do want to keep learning about my journey and my little baby's growth, please do subscribe and leave any comments if you have experienced any of the things I talked about in the video, or if you have any questions, any thoughts, and yeah. And thanks for watching. Bye.